Okay, here we did bilateral varicocele to you. You had surgery before. When did you have this surgery?
3 years ago.
3 years ago,
Yeah.
you had a varicocele, microscopic varicocele surgery in Hong Kong, right?
Yeah.
In Hong Kong, and it was a good hospital. It was a well-known hospital and well-known doctor, but still you had the recurrence.
Yeah.
Why? Why you think you had the recurrence?
After the surgery is still here.
Yeah, it
Yeah,
was
the
the
pain
veins
is
were
still-
still there, right?
Yeah.
How did you understand? You noticed that the veins are still remaining there.
Yeah.
So this is actually what I find in the surgery. He did the surgery a little in lower part, subinguinal. We use a little higher part, no problem. But when you ligate the veins, when you don't take them out, sometimes you are an unlucky case. 70% of the cases they heal, but 30%, like you, the vein does not disappear. Why? Because it had connections with the gubernacular veins in the down below, in the bottom of the testis. So I saw the gubernacular veins, they were still there. So even you ligate it from here, the circulation continues from the bottom of the testicle.
Yeah.
So what we do, we deliver the testis, we take it out, see all the veins, gubernacular, everything, and if possible, take them out as a long segment. If not possible to take them out, usually external vein is possible. Gubernacular veins, they are very small, and it's enough to ligate them. Sometimes if they are big, we are taking them out. And in the right side, why they didn't recognize you have also right varicocele? How it happened?
Actually, I just done the left side 3 years ago. The right side, the doctor said it's okay.
Do you
But
think it came later?
I think just sometimes it comes after exercise.
Yes.
Yes. But when we doing the exam, it may not so.
Yeah. So when you do the Doppler there, the first Doppler, they didn't recognize it. But when we do it standing up position, we see the large veins.
Yeah.
It was not as extreme as the left side, but still you have it.
Yeah.
Did you have pain in the right
Yeah,
side
yeah.
too? After
Definitely.
exercise mostly,
Yeah.
right?
Yeah.
Okay, now we did both of them. Now we will make a control with the ultrasound, the circulation of the testicles. Okay, this is right testis. What I look is the first important thing is circulation in the testicle. So when I see the blood vessels inside the testis, I am happy. Then I look to spermatic cord. Here, the pulsations. That means blood is coming to testicle. The next thing is how many veins is remained, how many veins are there, and we will wait them to disappear. Look, these are all little tiny veins and arteries. Normally artery is very thin. Only this, people ask me, what will happen when you take out the large veins? So look at the artery, they are very thin. You have two arteries side by side, and they are small. Only little tiny veins, one or two veins will be enough to drain the testicle. But when you have a very large vein, it's not draining properly, it's taking time, the flow is too slow, and it's heating the testicle. So there are always small tiny veins, and especially the veins around the vas deferens. Maybe, okay, this is vas deferens here. We have an artery in the vas deferens, and there are small little veins. Normally arteries are visible, veins are not visible. If you strain, I don't want you to strain too much after the operation for a 1 month period, but strain a little bit. Okay, when you strain, there is no vein visible now, it's good. Strain a little more. Okay, this side is perfect. So right side, this is perfectly finished. You don't need to wait, it is already gone.
Yeah.
So right side, I am now 100% sure it's finished. Let's look at the left side. Okay, now we are looking to left side. I can see the arteries inside. So blood is coming into the testicle. This is the most important part. Even in the operation, we could do nothing for the veins. An unsuccessful operation. The most important part is not to damage the arteries. Unfortunately, there is a risk still. I use the Doppler device inside the operation. I am very careful, but still there is a risk. This is the thing we are afraid, and this is a complication of the procedure. Even you spare the artery, sometimes you ligate it unwantedly, and in your case it is normal. I am happy. Okay, let's look at the cord now, and I have to put more jelly. Okay, now I can see the vessels very nicely. Look at this. This is the artery. You have a bigger artery here. I don't know why. From compared to right side, this is a huge artery. It's good for the circulation of the testis, but very risky for the recurrence. Maybe this is why you had the recurrence, because when too much blood is coming to testis, it has to go back from some part, and maybe this is why you had the recurrence, because too much artery, and it has to find some way, some route to go back, and maybe it pushed too much your external vein and caused the opening through the gubernacular veins, and they pushed and they made the recurrence. So now when we look at all these, the largest thing is artery now, and the remainings are invisible small things. Before the operation we were seeing a huge vein here, now it disappeared. Yeah, it's very nice. Very close to testicle, there may be some branches that I cannot take out. Look, this is testicle here, testicle. I can't dissect the veins near to the testicle because they divide into sub-branches, and there may be some remainings and they will disappear by time. I am looking for them. Strain now. Oh, very nice. Before the operation with straining there was reflux. Now it is gone. Look, all of these are small branches. I am looking for bigger branches. Okay, so before the procedure, when you come to me, look, there was really big veins. Now after the procedure they are gone, and 4.2 millimeter in the left side. It was really big, and when you strained there was a reflux like this. So it's now good, and in the right side there was a 3 millimeter vein, which was not as bad as this left side, but still you had the varicocele in the right side. And so we take out these veins, it's nice, and throughout the operation we find these veins, and yeah.
You find two big vessels in the inside, and
This is left side, this 4 millimeter vein, it's really huge. It's the external vein, it didn't disappear, so we dissect it, we take it out as a long segment. Yeah, in the recurrent cases, sometimes the segments are a little shorter, but still we take them. And in the right side, look, these are like a radiator, they were covering the testis.
Okay.
And yeah, so also we take these out. Okay, so as a summary,
Yes.
your operation was really nice and without problem, everything perfectly done.
Yes.
And what will happen after this? I want you to be careful. You are doing sports weightlifting. In Turkey, I call the patients back after a month and I do control everything again. But you will go to Hong Kong, and so we have to be in the safe side. Don't do any exercise, any pushings, as long as possible. If it is 3 months, it's good for me. After 3 months, you can start gradually, and don't increase your abdominal pressure. You can do some other exercises, swimming, but increasing abdominal pressure is risky. And your risk was you have a big artery. A lot of blood is going into testicle, and it has to find some way to come back.
Yes.
And vasal veins serve for this, but in your first operation, you had a remaining vein there, and
Yeah.
it pushed it, and it finds some way, and it began to work again.
Yeah.
Patency of the vein continued. And you are coming from Hong Kong.
Yeah.
How was the trip? Is it difficult? Because Hong Kong is really difficult to reach here. How did you
Yeah.
manage? How was your trip?
My trip, 17 hours flight,
Yeah.
and I transferred. I come from Hong Kong to Doha first,
Yeah, Doha. Yeah.
and it
Qatar
takes
Airways.
9 hours.
Yeah.
And
9
I-
hours from Hong Kong to Doha. Is
Doha,
it
yes.
9 hours?
And I was in the hospital for 3 to 4 hours,
Yeah.
and come to Turkey for 5 hours.
Yeah. Okay, it's a long way, and the
Very
turning back also maybe a little
Yeah.
longer too.
Yes,
No,
similar.
that's similar. And going to east is faster actually.
Yeah.
So you may go in 15 hours. It's
Yeah.
still long. And how many days after the operation now?
It's the 4th day.
4th day. So
Yeah.
you have on Monday?
On Monday.
Monday. Okay, so this is Friday now.
Yeah.
Do you feel yourself good enough to travel back?
I think it's good enough.
Yeah.
It's okay.
Yeah. And
Yeah.
it was a secondary procedure, so we
Yeah.
put a drainage tube.
Yeah.
We removed it in the second day, not the first day after procedure, second day after procedure. But still, you're healed, and you come here walking. You will now go in the airport. Of course, it is difficult. Of course, difficult,
Yeah.
but it's manageable. It is doable. So after now, we will be on contact through WhatsApp, through videos, such things. It is manageable. I do many cases every year, every day. So it is doable. Not easy, of course, difficult, but manageable.
Yeah.
And about the prices, do you think it is cheaper than Hong Kong, the operation cost?
Yeah, definitely much
Yeah.
cheaper.
Yeah,
Much
much
cheaper.
cheaper. But of course, you add the travel costs, everything, it
Yeah.
becomes a little.
But still, overall is still cheaper than the operation fee alone.
Yeah. So I try to keep it as low as possible. And try to be doable, manageable, and try to reach many people. Thank you for coming. Thank you for choosing us. It's an honor for us to hospitalize you here. Thank you very
It's
much.
also my honor too.
Thank you.
Thank you very much.
And I wish you a pleasant journey to home, safe journey, pleasant journey. Thank you
I
for
hope
coming.
so.